The situation is not much different on the Central Coast. San Luis Obispo County Hospital chiefs warn the crisis is being gravely underestimated. KSBY's Alexa Bertola reports.
Some local ICUs have no available beds this week. That's according to French Hospital's ICU director. Now he, with other hospital chiefs, want the community to know that COVID-19 hospitalizations along with ICU admissions are putting a strain on our hospitals.
Things have been really escalating at the hospitals, and we're starting to have to scramble for beds to put patients into.
On the front lines of the COVID-19 crisis, Mark Saul, French Hospital ICU director, says all 11 ICU beds at his hospital are full with 6 COVID patients and 5 others. Staffing is also getting stretched very thin.
You see all these people complaining about us being lumped in with Southern California with their 85% occupancy. Well, we're in just as bad a shape, if not worse shape, than much of Southern California.
Saul says our region is extremely vulnerable. He says the Central Coast already has half the number of hospital beds than most of the country. It's already a busy time of year due in part to the flu and other respiratory illnesses, and we're in a pandemic. He adds that the governor's stay-at-home mandate is needed for our area.
A lot of people have been railing against that as being unnecessary on the Central Coast because we're in such good shape. Well, they don't know what they're talking about. We're not in good shape.
Now on the brink of overflowing, he says at French Hospital they're making plans for an auxiliary ICU for COVID and non-COVID patients. The issue with that, he says, however, is there's not enough staff to care for the patients.
You can only ask people to work at 150% for so long. And right now we're okay and everybody's willing and able to do that. But at some point, things break.
In San Luis Obispo, Alexa Bertola, KSBY News.
The French Hospital ICU director says COVID patients who end up in the ICU typically keep that bed filled for weeks at a time.